Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwanitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey guys, welcome back to Between the Sheets. I have a new guest for you today. This is Sam Itzhaki, and he is known as Mr. Get Bigger Now. He is the CEO of Dr. Joe Capel's company and the man behind a movement that's helping over 100,000 men reclaim their confidence, size, and sexual performance. He's got over 20 years in this business, and I am so excited to have him on here and talk through the way he helps people with male enhancement.
Thank you so much for having Stephanie. I'm very excited to be here.
You're welcome. I always love having people who try things outside of the box on here because there are a lot of people who can't tolerate medications or who don't
Yes.
have access to certain things. And so talk to me about your way of helping men and kind of where this came from for you.
So would you like me to start with with a story or how
Yeah,
it's
go for it.
different?
Yeah, go for the story.
So sure. Like you said, I've been doing this for about 20 years, half of it 20 years personally and 10 years professionally. And so 20 years ago, I was a little curious and slightly bored because I had the weekend for myself. My wife was just away for the weekend and I wanted to try something fun. So I decided to walk into an adult store for the first time in my life. And I didn't really know what I was going to get. I just figured I'll go explore, get something fun to try, and that's it.
Yeah.
And so I walk in and I see this giant penis pump, like this big. I thought it was hilarious, but I was also curious about what it is and
Right.
what it can do. And so I end up getting it. And before I tell you about my first experience, let me just tell you how pumps work
Mm-hmm.
for those who don't know, right?
Yep.
So a penis pump works by generating vacuum pressure around the penis.
Mm-hmm.
And so essentially what happens is it just draws blood flow to the penis in a mechanical way.
Mm-hmm.
So it works very different than medications. And so anyway, I put the pump on, pump it up, and I just couldn't believe it. My penis was just growing in the tube with every manual pump I was doing.
Yeah.
And I thought it was the coolest thing. Now, that pump ended up breaking after a few minutes of use. It was just cheap crap, excuse
Yeah.
my language. But, I was disappointed because I lost my toy for the weekend. But at the same time, I was excited because I found something really cool.
Mm-hmm.
So fast forward a little bit, I just experimented with more pumps. I tried a water pump, injured myself, couldn't have sex for a week. And so I ended up doing hours and hours of research because I
Yeah.
realized, I can see this thing can work,
Mm-hmm.
but clearly I need to get the right pump, the right tool for the
Sure.
job, and learn more about it. It's not just the
Yeah.
right tool. And so I did hours and hours of research on online forums. There are
Okay.
online communities dedicated to just enlargement and male
Mm-hmm.
enhancement. And men, it's like the only place I know that men share their very personal information, like their
Yeah.
size, with each other and progress. And so I figured if I listen to what, someone who's been pumping for 10, 20 years has to say, I'll be successful. And so I ended up getting a pump that I noticed a lot of them were recommending.
Mm-hmm.
And it, I did see a difference. For the
Yeah.
first time, I actually noticed a difference in terms
Mm-hmm.
of erection performance and growth. Fast forward, this is where the story gets kind of crazy.
Mm-hmm.
Years later, about 2 or 3 years after I start using it, I'm seeing results. It's my favorite pump.
Mm-hmm.
I find out that the founder of the company is my wife's long lost uncle. And so
Wow.
she grew up not knowing who he was, not knowing his name or anything. And there was a rift in the family. And so one day he just decided he wanted to bring the family together.
Mhm.
And so he, made nice basically. Yeah, I just went to meet him for the first time, and her mom, my wife's mother, introduces me to him, to Dr. Joel Kaplan, the Dr. Kaplan. And so I just, I was shocked because he's the founder of this
Right.
pump. And so, yeah, we spoke about male enhancement for hours, and, what I think, men need, and
Mhm.
of course, my journey. And so that's the gist of the story. So yeah, it's been 20 years. I eventually became the CEO of the company.
Okay.
It just made sense. I had so much experience.
Yeah.
Yeah, I've tried 39 pumps, so I certainly know the product.
Yeah. Yeah, absolutely. Yeah, it's a big thing that I talk about with my patients at work. Being in urology, we have a lot of patients with erectile dysfunction, post prostate cancer things, and whatever. And a lot of times I tell them to go get one as exercise for their penis, in addition to helping them get their erection when they're trying to be intimate. But a lot of my patients need to have that consistency to maintain their ability. And then, like you've said, with some enhancement, some guys are able to do that. A lot of the times when I'm, telling people to use pumps, it's more on penile rehab and trying to get
Uh,
what they used to have or maintain what they do have. So talk to me a little bit about if a guy isn't necessarily having the issues that I see them for, but is just looking to try to get a little bigger, last a little longer, maybe get a little fuller. What are you recommending for them?
so first of all, it's a great topic you brought up. So
Mhm.
let's talk about erectile dysfunction and
Yeah.
the role of pumps, because there is some things I wish people knew and I wish
Mhm.
doctors knew. Of course, not everyone, but the standard medicine, and I'm not referring to cash businesses like
Mhm.
med spas that offer
Mhm.
PRP, right, for
Yeah.
example, or shockwave.
Yeah.
I'm referring to more traditional medicine urologists.
Mhm.
The kind of treatments that they have to offer is just extremely limited.
Yep.
It's it's pretty much whatever insurance covers, and the outcome is that patients suffer. They just don't
Mhm.
have the right solution. So penis pumps were originally invented to treat erectile dysfunction, and they
Mhm.
existed well before Viagra and Cialis. At
Mhm.
the time, they were the only way to treat erectile
Yep.
dysfunction, right? So you just something that someone just uses right before sex. They use a
Mhm.
pump to get an erection, roll down a cock ring or constriction
Mhm.
ring, and that keeps the blood in the penis. What most people don't know, including doctors, is that there are real long-term benefits.
Mhm.
And of course, some do, like you mentioned, rehabilitation, right? But it's just that I'm just referring more to the traditional side of medicine.
Mhm.
I just wish that more doctors knew that there are long-term benefits to using
Mhm.
a penis pump, like an exercise.
Sure.
When someone goes to the gym for the first time, they lift something heavy a few times,
Mhm.
their muscles will look bigger temporarily, right?
Right.
But those results will subside. What happens when the same person goes to the gym for a few weeks or a few months?
Mhm.
Very different results, right?
Yes. Mhm.
So it's the same idea. Pumps
Yep.
can be used like an exercise,
Mhm.
as an exercise. And so the kind of benefits you see after just 2 to 3 weeks, a lot of men start to report better erections,
Mhm.
more rigid erections. They start to report that it's easier to get an erection.
Mhm.
It just happens quicker. And
Yeah.
it makes sense because you're basically, it's an exercise for your, penile vascular system.
Mhm.
And there's plenty of evidence, as you know, of studies. It's interesting because, a lot of doctors and a lot of people don't believe that enlargement is possible with pumps.
Mhm.
I know from personal experience that it works. And I know from the personal experience of 100,000 of my customers that it works. Maybe not
Right.
100%, right? But it
Yeah.
works for the vast majority of men who are consistent with it. And so a lot of people don't believe it works. A lot of doctors don't recognize that it works. Yet there are plenty of studies that shows that
Mhm.
pre-surgery, it can enlarge the penis, right?
Mhm.
Just so that they can put a bigger inflatable device, for
Yep.
example, or it can reverse shrinkage,
Yep.
right? After, prostate removal.
Yeah.
So there is plenty of evidence to show that it does work. It just,
Absolutely.
a lot of people won't admit that it works for actual enlargement.
Right. Now let's set some expectations because we're not going to grow 3 inches with enlargement. So, what are you
100%.
talking about with enhancement so that people can have a realistic expectation?
Yes, that's actually a very important question. Yeah, so this is the problem with the male enhancement industry.
Hmm.
You know, everyone, men and women, get all those like spammy emails like, take this pill and you'll grow 4 inches in 3 days. And it's like, no one believes it.
No.
Yes, so it's important to set the expectations right.
Hmm.
It's an exercise, right?
Yeah.
And so after a few weeks, you notice improvement in erection performance,
Hmm.
quality, things like rigidity, sensitivity, maybe the ability to get hard faster.
Hmm.
After a few months, you start seeing just more of that permanent kind of results,
Hmm.
both in length and girth. You do see girth earlier. You
Hmm.
could see girth after about a month,
Yeah.
but it's very, it's not a lot. And
Hmm.
it's more girth than length. And, guys, we measure our ego
Right.
with length. There seems to be a disconnect between men and women because women care more about girth than length.
Yeah. Well, and the bigger is always better is not actually true. There's a lot of
Right,
women who want average or smaller penises because they have pain with penetration or their
right.
cervix is, prolapsing a little bit and a little bit lower. And so, just to give some guys here some help here, most women are not looking for the 8, 9, 10-inch penis.
No, no.
Most women are looking for 5, 6, somewhere in that area to be fully satisfied. And so if you are on that side of things, use it, get the enhancement, but don't expect 3 inches.
Yes, I agree 100%. So here's the thing. This is what I've learned from being on the ground, let's call it. The reality is that most men, not everyone, of course, most men want a bigger penis. I think it's just tied to our ego. It's obviously better if you're comfortable with who you are, right?
Mhm.
With your body in general, with your penis size. It is better. But the
Mhm.
reality is that a lot of men want something bigger. And I've learned from my experience is that it doesn't matter, like, size doesn't really matter when it comes to who wants a bigger penis, right?
Mhm.
There are plenty of small people who want a bigger penis. There are plenty of bigger people like who have a bigger
Mhm.
penis and they still want a bigger penis.
Mhm.
So it's clearly not about the penis.
Yeah.
It's about, I don't know, ego,
Mhm.
whatever it is. So yeah, that's one thing. Um, there have been plenty of studies, maybe not that many, but a nice amount of studies about size. The thing is, most of those studies were just asking women what's their preference. And
Right.
most people, if you ask them what's 6 or 7 inches it is, just to show you, they're not gonna get it right.
Right.
And so there was actually one particular study where they gave women an object,
Mhm.
um, sort of like a dildo, right,
Mhm.
of different sizes. The average was that women want something that is slightly above average.
Mm.
So it was between like 6 and 7, like 6 or 6.5, while the average is about 5.5 or 6.
Mhm.
Yeah. I think girth is really what women care more about.
Yeah.
Like you said, length matters less
Mhm.
from anatomical perspective.
Yeah.
Men want what men want.
Yeah, absolutely. And whatever brings people pleasure. So tell
Yeah.
me, for your guys who are, trying to get this rehab and getting their erectile dysfunction improved, do you have a protocol for them? Do you have a specific sequence of how often and how long to use it that you recommend?
Yes. So first of all, let's just talk about the benefits of pumping
Hmm.
because it's not just about size. It's a
Right.
nice benefit of it, but it's only one benefit.
Hmm.
So as men get older, just like the rest of the body, things atrophy.
Yeah.
And so when you look at men who are older, men over the age of 50, about 50% of them report some form of erectile dysfunction.
Yeah.
It can be either, a full-blown erectile dysfunction where they can get up and they can have penetration,
Hmm.
or it could be just soft erections.
Hmm.
But soft erections is something that is extremely popular with, extremely common, even with men who are younger,
Hmm.
right? You don't need to be 50 to have soft erections. There are plenty of men who are in their 30s, maybe late 30s,
Hmm.
mid to late 30s, who have softer erections. And so pumps, by using a pump regularly, you get plenty of other benefits. All
Hmm.
that regular blood flow when you engorge the penis as an exercise over and over again,
Hmm.
you essentially reverse atrophy,
Yeah.
right? And so you can prevent shrinkage, which is another thing that happens with age.
Hmm.
By the age of 60, men can lose up to 20%.
Yeah.
Obviously, not everyone loses that, but no one likes to hear that they lose size, and that's the
Right.
reality. And so it's important to use to get an erection regularly, right?
Hmm.
Nocturnal erections are part of our biology, which is good. It's also important to have sex regularly.
Hmm.
Use it or lose it, right?
Yeah, it is.
And yeah, using a pump as an exercise is just a great way to bring all the blood flow to the penis
Hmm.
regularly and exercise the capillaries, exercise the blood vessels.
Hmm.
And so the kind of benefits you see is just better erections all over,
Yeah.
more rigid erections. It's quicker to get an erections
Hmm.
and yeah, bigger erections. Now,
Yeah.
when it comes to erectile dysfunction, it's actually possible to reverse mild cases of erectile
Hmm.
dysfunction. The vast majority of people with erectile dysfunction, it's either the root cause is either poor blood flow
Hmm.
or venous leak,
Yep.
right? Where blood can go into the penis, but it goes back. And so
Right.
they can
I
maybe
always
get an
describe
erection.
it as, we all have valves throughout our body. That's why when we
Yes.
stand up, the blood doesn't drop to our feet. And so in the penis, same thing. When the blood flows in, these valves are supposed to
Yes.
close and hold it. And for some guys, actually a quite a large population of
Yeah.
the men, they get saggy, weak, and they let the blood flow back flow. And some of them, it happens very quickly in only a minute or two. Some of them, it happens over a few minutes. But yes, that's called venous leak, and it
Mhm.
is very prominent for men.
Yeah. And those valves in the penis are a muscle. And so
Hmm.
just like the rest of our body, with age, muscles atrophy when you don't use
Yeah.
it.
Saggy and
Yes,
weak.
exactly. So one quick way to overcome that, the quickest way without medication, medications are good. They just increase blood flow,
Yeah.
right? So if you have more inflow than outflow, it helps.
Hmm.
But the best and quickest way is to just use a cock ring
Hmm.
because that will just prevent the blood from going back or slow it down.
Yes.
So that's one way. But pumps, when used regularly, are shown that they could actually reverse mild erectile dysfunction, especially when it's about blood flow.
Hmm.
And so,
Yeah,
yeah,
it's
that's
amazing. I love recommending them for patients. And, the biggest thing for me is when guys tell me no, it's almost always because it's not sexy, it's scientific. They don't want to use it at that moment. And it really comes down to educating them about it being a rehab program and an exercise program for their penis, and not just you're using it the moment you want to have sex to get your full erection, which you absolutely can. And for some guys, that's very
yeah.
helpful, but like what you're saying is we need to be using it on a consistent basis, exercising those blood vessels, that tissue, and that is what leads to better, longer lasting erections.
Yeah, exactly. It's just like, staying active as you get older. It's very important. If you want to prevent muscle loss, you have to do it. Same thing with, we all brush our teeth, not because we
Hmm.
have cavities, to prevent cavities. So it's a great prevention tool, a prevention of atrophy, prevention of shrinkage. Yeah, and it is possible to reverse mild erectile dysfunction. I'm talking about soft erections, not
Yeah.
someone who really can get it up, right?
Right.
Those people can use it with a cock ring as originally intended.
Yes.
Uh,
Yes.
but the
Absolutely.
exercise part is very different. And, I just wish more people knew about.
Yeah, absolutely. And I think, those of us that are actually in, the sexual medicine side of urology and different areas of medicine, we're on board with it and we get it. But I have colleagues within urology that sexual medicine isn't their focus. Maybe their focus is kidney stones
Mhm.
or something, but they also see patients who walk through the door for whatever reason. And if a patient with erectile dysfunction comes in, it's automatically Viagra and Cialis is where the starting point is. And, a lot of it, there's a lot of questioning that you have to ask these guys. Are they masturbating too often with a specific type of porn and a specific
Mhm.
hand grip, whatever, that then when they're with a partner situation, they don't get erections. That's one way,
Right.
right? If they're getting the soft erections, like you mentioned, if they're not maintaining the erections, there's a lot of questions that we have to pull through to figure out what is actually going on and what is his actual erectile dysfunction, because there's various forms of dysfunction. And one of my favorite things is getting them to use the pump, whether it's mild ED or my penile rehab. I have a lot of guys who are post prostate cancer in my world, whether that's radiation and hormone therapy or a prostatectomy. either way, they're not getting good erections for a certain period of time during their treatment. And it's so important in that specific time frame
Right.
to be using these pumps and doing the rehab, because it is a lose it or use it or lose it part of your body. And so it's so important. And I love that you guys have this product. So tell me a little bit about the pumps that you offer.
Sure. So we have different kinds of pumps. We have manual pumps. We have automated pumps. Obviously, I would recommend the automated one. I personally designed it after trying 39 different pumps. It
It's
just,
almost like you know what you're doing.
oh yeah, almost. Yeah. I want to make sure I really know all the deficiencies in all
Mm-hmm.
the other pumps. And there were so many deficiencies, right? Like there are many pumps who are not considered a medical device, which,
Mm-hmm.
by the way, they're all supposed to be.
Yes.
And unfortunately, there are many companies who just make like a sex toy grade pump.
Mm-hmm.
Many of them don't have a gauge, so you just don't know what level you're pumping on,
Mm-hmm.
right? So imagine if everyone outside, drove their car without a speedometer, it would be chaos, right?
Mm-hmm.
It's very important to know what pressure you're applying to the penis.
Yeah.
And without it, you can definitely injure yourself. That's what happened to me. My
Okay.
second pump ever was a water pump, and it just doesn't have a gauge.
Mm.
And so I just over pumped. I
Yeah.
got fluid buildup on the skin.
Mm-hmm.
I had to stop pumping. I couldn't have sex for a week. So the right thing to do is to get something that is medical grade,
Mm-hmm.
get something with a gauge, and something with a good protocol. Because
Mm-hmm.
having a good product without a protocol, without knowing what to do with it is, a little better than having a bad product, but it's still pointless.
Right.
And that's another thing I noticed. Even the better pumps I tried, they came with just no protocol whatsoever.
Mm-hmm.
The instructions were just put it on and just choose a level, low, medium, or high.
Mm-hmm.
And so I put it on the lowest level and it was way too much. And keep in mind, I've been pumping for 20 years.
Right.
So if it was too much for me, it's it's definitely too much for most people, right? Especially
Yes.
someone who's just starting, because the first 2 to 3 weeks, a big part of the pump usage is you want to condition the tissue,
Mm-hmm.
and so you want to start very low, and that's what our protocol states. You start on low pressure for a low period of time,
Mm-hmm.
10 minutes, two sessions of 10 minutes at a low pressure, and then as time goes by and as your tissue gets used to the pressure, right, that conditioning part, you can slowly increase the pressure and you
Mm-hmm.
can slowly increase the duration of each session to 15 minutes or 20 minutes later.
Yeah.
And so, yeah, the one thing I noticed is that pumps did not have a protocol. Just the control wasn't good.
Mm-hmm.
Yeah, so I made my own, and it's
That's
absolutely great.
amazing.
Thank
Yeah.
you. It's my
The other reason why I like the automated ones is, especially for my older guys, they have dexterity issues, and
yes.
pumping for 10 to 15 minutes is very exhausting. And if you have any carpal tunnel, arthritis,
Right.
anything, that is going on there, that makes those very difficult. Whereas the
Hmm.
automated, you can put it on and hold it in place, but you're not constantly pumping for that 10, 20 minutes, whatever.
Yeah, exactly. You just put it on, set the pressure you want, and the pump does the rest.
Mhm.
That's exactly the kind of pump I have. And would you like me to show it to you?
Yes, please do. So for those of you that are listening, pop over to our YouTube station because you'll actually get to see it here.
Yes, exactly. So here it is. So there are
Okay.
two parts, two
Mhm.
components. You have the cylinder or the tube, and those come in various sizes. At least ours come in various
Yes.
sizes. And then there's the pump component. And so you just plug it in,
Okay.
you put it on the penis, you turn the pump on, and just set the pressure, and the pump does the rest.
That's awesome.
It's super easy.
Yeah.
And you'll see, if I just hold it, you'll see that my hand gets red because it just draws blood to that area.
Yes. Yeah.
It's pretty much how it works.
I joke with my partner or with my patients that it sucks harder than their partner can for them.
That is very true.
Yes.
I don't know if anyone ever measured
Yeah,
the
probably not.
level.
There's not science behind that, but it makes a nice little icebreaker joke.
Yes. I think what is the saying? I don't know it for a fact. I just know it's true.
Right.
Yeah.
Exactly. Exactly. Yes.
Yeah. So here it is for
Oh
people
yeah,
who
that's
want to
getting
see.
some
Do you
good
see the
suction
redness?
there.
It's
Yep.
pretty much all it does.
Yeah. That's amazing. So,
Yeah,
and then what is the price point for these? Because I know if you go online and look, there are super cheap ones and super expensive ones. And it is kind of, you get what you pay for. Like you said earlier, you
exactly.
got one and it broke within a couple minutes of using it.
Exactly. Yeah, so I would definitely avoid the cheap ones because you do get what you pay for. The last thing you want is to injure yourself,
Mhm.
right? And so don't you dare get a pump without a gauge. That's rule number one. Definitely get a medical grade pump, preferably something with protocol. Our pumps all come with protocol,
Okay.
with different cylinder sizes for different people, right? Because
Mhm.
penises come in all shapes and sizes. And we also have male performance coaches who can help
Okay.
the user if they have any
Yeah.
questions about it. And that was actually one of the things I noticed trying all those pumps. When I tried to call customer service, not a single one can help me with questions
Yep.
about pumping. They can help me with my order, maybe.
Mhm.
Where's my order? Or my pump broke. They can maybe
Right.
send a replacement. Some of them I couldn't even reach, but
Yeah.
not one I could even talk about pumping. And
Mhm.
so that's what makes our company unique. We actually
Yeah.
offer that as part of the product.
I love that. I love that. I have patients bring their pumps in and ask me to help them figure out how to use them
Yes.
because there isn't any help for them. So I love that you offer that. That's amazing.
Thanks. Yeah, and
Yeah.
that's another thing. I noticed that a lot of doctors, the ones who do, prescribe pumps,
Yeah.
uh, they don't necessarily know enough about
Mhm.
pumps, and so
Right.
that's what made me decide to offer it because we have the expertise.
Yeah. Now, is your pump, I know some of them are starting to get where they can get FSA or HSA that you can use your money accounts for them. Most of them are not going to be covered by insurance, but sometimes you can use your accounts for them. Has your company gotten that yet?
Not this time. It's something we're
Okay.
working on, but not right
Yeah.
now.
Yeah, it's definitely a newer thing, especially in the penis pump world, but
Hmm.
it's something that I love that companies are looking into because we should be able to use it for that. I mean, it is like you said, it's a medical thing. We're using it. It's medical
Yeah,
grade
exactly.
and we're enhancing blood flow and things like that. So
Yep.
hopefully insurance companies will get on board with it in general, but at least for the HSA and FSA would be helpful for sure.
Yes,
Yeah.
absolutely.
Now, does your pump come with the cock ring or do you purchase that separately?
Yes, it comes with a cock ring. We do have other cock rings.
Mhm.
We have a variety, but yes, it definitely comes with cock rings, three different sizes
Okay.
to accommodate all sizes, of course.
Correct.
Yeah.
Yes. Yep. I
Yeah.
always tell my guys, especially if they're the ones that are just they can get the erection but have difficulty maintaining it. I always tell them make sure you get a variety pack because you want one that fits you correctly. You don't want it too tight where you're turning purple, and you don't want it too
Exactly.
loose where it's not doing its job. So that's really important.
Exactly.
Yes.
Yeah,
It's
I always
also important to
recommend
take it off right away after you're done.
yes, and not go over the 30 minutes if you're not done.
Yes,
You
exactly.
know,
I have
I
had a couple guys come in with pretty bruised penises because they
oof,
fell asleep or left it on too long. So that is an important
that's terrible.
fact.
Yeah, that's yes. The
Okay.
last thing men want is to fall asleep with it. It's actually dangerous.
It is. It is.
Yeah.
It's very
So
dangerous.
definitely,
Yep,
yeah.
absolutely.
So the rules are use the cock ring that is the least restrictive
Mhm.
that works for you, right? So you want to
Yes.
go with the largest, see if it works. If it works, great. If it doesn't, go one lower, either
Mhm.
a smaller one or a tighter one, depending on which cock ring you use. And yeah, never wear it for more than 30 minutes at a time.
Mhm. Yep.
And yeah, don't fall asleep with it.
Yeah. For sure, for sure. That's
Yeah.
awesome. Does your company have any other products that you wanna talk about?
Yes, absolutely. So we have an extender. Are
Okay.
you familiar with those? Yeah. So it's kind of the same idea like pumps.
Mhm.
It's, most people don't know that it works. Most
Mhm.
doctors won't admit that it works, but it works amazing, especially for length.
Mhm.
So before I started doing all of this, I told you the story and, I didn't know this was going to be my life's mission. I kind of fell into it.
Yeah.
I went from customer to CEO basically.
Right. Right.
And so before all of that, I used to be a software engineer. And
Okay.
as a software engineer, you sit all day and you program.
Mhm.
And so I used to wear my extender in the office underneath my pants
Yeah.
with people in the office.
I love it.
And so I wore it for hours a day
Yeah.
because why not? Why not enhance myself
Right.
while I'm doing something else? It's just more efficient.
Yes. There you go.
Yeah. But anyway, the point was that it worked so well that my wife begged me to stop very
Well,
quickly too, like after like 2 months. It's
Wow.
just something that works very quickly for length. And the best way to go about is to combine both of those things. When you
Mm.
combine the extender, which is essentially a stretcher, you just keep the
Hmm.
penis stretched for a long time.
Yep.
And so when you stretch the penis and then engorge it with blood using the
Hmm.
pump, it works amazing.
Yeah.
So we have that. We have a red light accessory that goes around the cylinder
Cool.
because heat is great, right?
Hmm.
It just relaxes the tissue, and I'm sure you know there's just
Yeah.
so much research around red
Hmm.
light for blood flow, right?
Yeah.
It increases nitric oxide production, improve mitochondria function.
Hmm.
So yeah, it just there's just so much research around
Yeah.
it that we introduced a red light wrap for the penis pump.
Neat. Have you done any research on that with Peyronie's for the curvature and like kind of reversing the plaque at all?
No, but there's plenty of research with pumps and
Yeah.
extenders and Peyronie's.
Yeah. So we use extenders a lot, especially in combination with the Xiaflex when we're trying to break down that plaque. But
Mhm.
bringing up the red light makes me interested to see if, right after injury, if using that red light wrap would help prevent that plaque from really hardening and getting the curvature if they knew, like, because some of the guys don't know when the actual injury happens because it's little micro injuries over time.
Right.
But if you have a significant injury and you know it happened on Tuesday at 6 p.m., I just wonder if you got this red light therapy right away and started using it, and the pump and the extender and all of these things that increase the blood flow, if that would actually help prevent that plaque from forming in a hard enough fashion that it would actually end up preventing the curvature.
That is so interesting. That is a
Yeah.
great idea. I
Yeah,
don't know if we can get a large enough study uh, of
those
people
guys
who
would be
injured
hard to come
themselves.
by.
Yeah, exactly. But it's a great idea. I love it. Yeah,
Yeah,
I'll
I mean, I
definitely look
just
into
as
it.
you're talking, I'm thinking about through
Hmm.
my patients and because Peyronie's is really difficult to treat, and for a lot of guys, it gives them erectile dysfunction,
Right.
and it gives them, dissatisfying sexual experiences. And we don't have a lot to offer them. I mean, it's 8 injections of Xiaflex and or surgery. So I'm just, as you're talking, I'm like, oh, I wonder if that would work. That would be such a cool thing to suggest, even for some patients just to try and see what happens.
Right. Yeah, that sounds like a great idea. Well,
Hmm.
if you know anyone, feel free to suggest that.
Yeah, I
Actually,
will.
I will sponsor that.
Okay. All right. Excellent. I love that. I'll be in
And
touch.
another thing, using that, so you already use extenders, and
Hmm.
pumps are also useful when it comes to treatment of Peyronie's. But I just wonder if using a red light with a pump, even if it's
Hmm.
after the injury, just as part of the
Yeah.
treatment, could accelerate things because when it comes to red light, it's known that it helps with recovery and just
Yeah.
uh, like wound healing, for example.
Right.
There's plenty of research on that. So again,
Hmm.
if you want
Yeah.
to conduct the study, I'm happy to sponsor it.
Perfect. Perfect. Yeah. We'll figure that out. That's awesome. Okay. So, any other things that you want to share with the audience today that you guys have?
We have supplements which could help, but we're not making those ridiculous promises. Just we're
Yeah.
talking about L-arginine, L-citrulline, things that can help increase blood flow throughout the body, which
Hmm.
could help with, blood flow in the penis. But
Yeah.
yeah, but our top products are definitely the pump, the red
Hmm.
light accessory, and the extender. And when you use all three of them together, it works absolutely amazing.
Yeah.
And you actually see the difference when you use the pump with the red light or without. You notice the difference
Interesting.
because the red light basically heats the penis
Hmm.
up from the inside out. It
Yeah.
just shoots the red light and the near infrared light.
Yeah.
That energy gets absorbed, and the penis gets hot.
Yeah.
And so you see the difference when you're in the cylinder. When your penis is in the cylinder,
Hmm.
you fill it up much quicker because that heat just relaxes everything.
Yeah.
Yeah, so that makes a difference.
Very
So yeah,
cool.
those are the three
And is the
products.
red light like a wrap or a sleeve? How are they using it?
Yeah, it's a wrap that you
Okay.
just wrap the cylinder with.
Okay.
Yeah.
Excellent. That's really cool. I love that product. That's awesome. We do hear about red light therapy for so many different issues
Mhm.
right now. I love that you guys made a wrap for that. That's awesome.
Yeah, it's I mean anything to increase blood flow, right?
That's right. That's right. I love it. So how can my listeners find your products and go shopping and get in touch with your company?
So they can go to my website, getbiggernow.com,
Okay.
or they can find me on social media, Mr. Get Bigger Now.
I love it. I love it. And there's plenty of shopping opportunities. And, I'm sure there are different sales and things that come along. So you guys need to go and check that out. And Sam, I really appreciate you being here. This has been such an enlightening conversation. And like I said at the beginning, I love finding non medicine ways of helping my guys because there are just so many benefits out there that don't have side effects or have less side effects than
Yes.
medicines. I really appreciate your time and your expertise today.
Thank you so much for having me, Stephanie. It's been
Yeah,
a pleasure.
absolutely. All right, everybody, go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.